I'm Sasha, owner and creator of the Little Dog Retreat, and you have just found the best place for little dog mental health, training, and wellness. And today we're going to be talking about how to care for your elderly or aging dogs. So we have Mercedes here. She is a full-grown, purebred Italian Greyhound, and she is 15 years old. So she is definitely in her golden years. We've had her for 15 years. We literally got her as a puppy, and there are a bunch of differences between what her age stages were at in different time periods of her life. We're going to go through some of the biggest changes that happen as your dog ages, and then how to basically not just cope with those, but how to help them in their life so that they actually still feel loved and welcomed. And of course, it's a little bit less stressful for you because you kind of know what's going to happen and know what's going to go on. Now, every dog is different. So Mercedes is 15 and she has a lot of health problems, even though she's been healthy most of her life. So with Mercedes, she has what we call an episode. It's sort of a seizure, roughly about 2 weeks. Now, they used to be more persistent and they've kind of waned a little bit. We notice that they come in phases, and we have noticed over the years is as she's gotten these, she loses more and more eyesight, more and more hearing, and of course bodily function. So the best way you can take care of your dog is pay attention first and foremost to any of the changes that are going on. Your dog will start to display symptoms as they age. Some of those symptoms are going to include changes in their behavior, like rapid peeing, not being able to hold their pee for long periods of time, incontinence. You'll notice digestive changes. You'll notice feeding habit changes, whether they drink more water or whether they want more or less food. All of these are indicators that something is changing physiologically in your dog's body. This is a great time to go and visit the vet. A lot of vets will recommend with an elderly dog, you visit them every 6 months. I don't know that that's totally necessary. It really depends on your dog and the situation that you are coping with, whatever their ailments are. So for instance, Mercedes is not on medication. We are a holistic household. We really strive as much as we can to keep them in a natural state, which means medical free. So we have spent throughout the years, we've gone and done medical care for her gums and for her teeth, but for the most part, she doesn't take any medications. Now, that being said, I'm going to show you how we approach her and the differences between her and her health conditions and our Pomeranian and her health conditions. Okay, so the first thing we're going to really point out is what's coming into modern science is the awareness of gut health. So the gut health in your dog is going to speak volumes to the amount of inflammation that your dog is going to actually endure throughout their life. If you can hedge off any ailments by having a good quality probiotic for your dog, also you can add something like a very plain sugar-free yogurt to their food consistently to help with their natural healthy gut flora. That's going to be amazing as they age. What it comes down to, no matter what, is as your dog ages, they're going to naturally have an increase in inflammation. This is natural and this is normal, and it's just something that you'll want to be aware of. Inflammation is going to come a couple different ailments. First and foremost, the classic arthritis. Arthritis is basically your general joint pain that you're going to see. If you've experienced it yourself, you know how much it can hurt. Now with inflammation, it adds to the pain because what happens is as the inflammation builds, it actually breaks down the cartilage between the actual bones, and now you have bone on bone pain in addition to the inflammation and nerve pain. So a couple things you can do for that is add a few of the suggested or recommended joint vitamins to their diet, like glucosamine, MSM. You can find these in most of your over-the-counter purchases. It's a basic dog vitamin. What you're going to want to do is just check their joints. You'll notice there's inflammation if the joint doesn't move as well, or if there's a lot of triggered pain. So your dog might actually walk or limp. You'll notice that hip or that knee or that ankle may have more inflammation. The other thing, of course, with dogs is going to be their eyesight, their hearing, and their general digestion. With eyesight, you'll notice the black of their cornea. If they are getting what's considered aging cataracts, you'll notice the white or kind of milkiness in their eyes. That means that they are losing eyesight. It also means they are losing their depth perception. So when they are out and about, it's going to be something you want to keep in mind. If they are on a walk, if they are in a yard, they may actually lose the ability to see how much depth they have between themselves, a car, themselves, a fence, themselves, and another dog. The other thing beyond that is their sensitivity level. So their sensitivities are olfactory stimulation that happens within the nose. So you notice when you go on a walk, your dog is going to want to smell literally everything. That is a stimulating factor for their olfactory. What happens is the olfactory actually subsides. They lose some of that sensitivity, but it increases the irritation factor. So smells that may not have irritated your dog in the past are now going to irritate them potentially more. Things like perfumes, colognes, candles, essential oils, natural plants, or even fabric softener or laundry detergent smells. So just kind of keep that in mind. Mercedes is getting a little restless here. She's like, what's going on? I'll show you how I pick up a little dog. And so in general, when it comes to small dogs, picking them up, helping them out, if you're going to be bringing them into a car and you have a little dog, realistically, let's see if Mercedes, come here, baby. You're gonna wanna use kind of a full body pickup. So I personally go in front on their chest and then I go behind by their bottom. You can scoop them up if that's something they're accustomed to. That's great. The other thing you can do if they're not feeling, if they don't do kind of the natural swoop, Mercedes, is you can also just do the chest cavity pickup, where you just come on the side, you put your hands like this right between their two front arms and right underneath their armpits, and you're going to scoop them up. Always make sure that your dog feels safe and secure by their bottom or their feet. If you're bringing them in a car and they get really dizzy, try to go ahead and put them down where the feet would go so that they don't get dizzy during a car ride. I'm gonna put her down for a second. There you go. When petting your elderly dog, remember, because of the inflammation that they may be occurring throughout the spine, throughout the joints, it's better to kind of have the concept of petting them like a cat. Realistically, the big pats are kind of like big, aggressive, or excited kind of petting needs to subside. And now you're just gonna do little tiny movements, nice long strokes, and things that would calm them. So when calming a dog, you can go from the neck all the way down through the leg of the spine, on the side of the body. This is something that would naturally occur with a mama dog and a baby pup. So this is something that will be indicative. They will immediately respond in a calming fashion with this. So this is Haley Bean. She is a 13-year-old Pomeranian. She's had a pretty good life without a lot of actual health issues, but in her golden years, we've noticed that she's lost a little bit of her hearing. She has full eyesight and full sensory with her olfactory sensor, so she's actually doing pretty well. Body-wise, joint-wise, she's actually doing okay. So what I want to point out with Haley is really oral sensitivity and stomach distension. Now, there are a couple things that happen to your dog as they age. First and foremost, they actually produce a little less of the stomach acid, so things like kibble going in can be harder to digest. They can produce an overwhelming amount of saliva, and then it can go down and create more stomach acid if they have an irregular eating pattern. And so what can happen is they can basically get the choking, where they want to vomit their food more often. If you have a dog that's vomiting full pieces of kibble, they're actually eating too much kibble at a time, and you can either soak it or switch up their food. But as an aging dog goes, you'll want to switch from kibble to a more raw or meat processed diet. When I say meat processed, you can find grain-free pate-like dog food. So if you're not into making your own dog food, you can certainly find that, and we do supplement with that as well. Really, what you want to look out for is the stomach distension, which is basically where the food goes down, it produces not enough digestive fluid to digest and break down the actual food, or it produces too much. So if they're not producing enough digestive fluid, that's where you'll end up with this vomit, where they'll have these full pieces of kibble, basically in mucus. If they're producing too much, you'll notice the bloat and possibly even the distension of the stomach, where the stomach actually twists a little bit. It gets too much air in there. It can be very painful for your dog. It can also be life-threatening. What you can do is switch to micro meals. Switching to a micro meal means that you're giving your dog less food per meal. Now, your dog might actually need a lunchtime depending upon their activity level, but essentially you'll just want to do more micro meals and also make sure it's softened for them. The other thing is, as your dog ages, it seems to be universal that your dog will have oral sensitivity. This comes in a couple different degrees. Oral sensitivity is going to be where their gums can be inflamed. They may have an underlying health issue there. Any of that oral sensitivity, or with the teeth falling out, is going to make it harder for your dog to actually crunch and chew the kibble, to make it more challenging for them to go ahead and get all of that food down in one sitting. What I recommend for that, soaking anything that you are going to be giving them that's like a kibble or a meat that's a dehydrated meat, and then also just creating those micro meals. Now, it is typically seen as best to keep your dog active in their geriatric years. I will say within reason. Mercedes, she's lost her eyesight, she's lost her hearing, and most of her sensory awareness is pretty low. So we do not walk her. She doesn't jump on the bed. We have a bed that is now next to our bed. She does not go out on walks. However, Haley, who's just a year and a half younger than her, what we've done is actually increase her activity load. So it really depends on your dog. You can talk to your vet about this, but you you kind of know your dog best. So for instance, Haley's having coughing at night where she gets kind of that chest cough. We have found that a smaller, shorter walk every single day actually helps aid that, and she's getting a better endurance built up, and so she doesn't bother her joints. She's happy as can be doing it. She doesn't get fatigued during it. But again, we're going on shorter walks every single day opposed to a longer walk. So the last two things I want to point out are when you're approaching your dog. When you approach your dog, and especially when they are completely in a deep sound sleep, because you'll notice your older dogs sleep very soundly, almost like a nice heavy log. When you come up to your dog, I always recommend touching them just a nice relaxed touch first, so they are aware of your presence. Let them come out of the disorientation of their nap or their sleep, and then be aware of who you are. If you have young children, or if you have children around them at all, make sure that they are aware that your dog at this age is just like a cute little 90-year-old lady or a 90-year-old man. They may look like a sweet puppy still, but they are actually very, very old in our context of aging. So just have them go ahead, place a hand on the pup, or make sure that they are aware that they do this with you if they're very young kids. Just place a hand on the pup so the pup can, again, become oriented to what's happening and come out of the sleep without a problem. The last thing I'm going to show you is very, very important. So with aging dogs and with dogs in general, no one really likes to do nail clipping because for some dogs it's very traumatic. If you have a dog that's very easy to do nail clipping, that's fantastic. You'll want to keep in mind, as your dog ages, their nails will grow a little bit faster. So you want to be on the nail clipping. Two things can actually happen with this. Number one, when they are walking around and their nails are too long, it's going to put their joints out of whack, which can aid in the discomfort of aging joints and the arthritis that they may feel. The second thing is that it's actually going to be distorting their ankle knee to shoulder or ankle knee to hip ratio. So as your dog walks, for example, with a longer nail, I'll go ahead and put her down. She's like, what's going on? With a longer nail, it actually forces your dog, instead of walking on the pad of their foot, it forces them to walk on that bony heel of their foot. And that again is going to put them out of whack, which will aid any discomfort that they're already feeling. I hope this helps, and thank you so much for watching. Be sure to check out and like, subscribe, and absolutely share this with anyone that may find this helpful, or anyone that you know who has an aging pup. Check out our training and wellness programs at the description below, and thank you so much for watching.